Our mouths are full of bacteria. These bacteria, along with mucus and other particles, constantly form a sticky, colorless plaque in teeth. And if that plaque is not removed, it can cause tartar on your teeth. We spoke with Dr. Robert H. Gregg at Millennium Dental, who gives us more information on gum disease.
Gum disease is an infection that involves inflammation of the gums that also attacks the bone that support the teeth in the mouth, and is having increasingly associated connections with problems of the heart, stroke, diabetes, preterm birth, low birth weight, and other conditions in the body.
We asked Dr. Gregg what are the signs and symptoms of gum disease.
The signs and symptoms of gum disease involve puffiness of the gums, redness of the gums, swelling, recession of the gum tissue from the tooth, looseness of the teeth, but increasingly it's a painless disease, so most people don't know about it until it sneaks up on them and the damage is severe. One way to do a check is to investigate the source of bad breath, because oftentimes the bacteria that cause gum disease give off a sulfur or rotten egg type of a smell, and that can be identified with gum disease. Severe gum disease doesn't become severe overnight. It takes literally decades to progress from something that's swollen gums to something that is now destroyed bone. But by the time it gets to be the moderate to advanced type of gum disease, it is very obvious to diagnose and easy to diagnose. But typical conventional approaches are usually unsatisfactory to the patients, and often they opt out of having treatment. So that's where we step in.
Dr. Gregg told us about the treatment options for gum disease.
The traditional approach to treating moderate to severe gum disease is a cut and sew technique that involves suturing the gums back into a new position with less of the gum tissue than the patient walked in with. That often leads to unsightly appearance of the teeth, sensitivity to the teeth, difficulty in eating hot foods and spicy foods. Also leads to recurrent disease as well, because it's harder to treat and clean those teeth for the patient. We've developed a protocol for treating moderate to severe, the advanced forms of gum disease, in a way that involves no removal of tissue, only the destruction of the germs that cause gum disease inside the pocket, and allowing for the bone to regenerate and thus reduce the pocket size and also the associated inflammation and bacterial load. Using the Paralase and the Lanat protocol, there's control of bleeding using the laser, so there's no blood. We seal nerve endings around the tissue, so there's no pain. We also seal lymphatics so the tissues don't swell. So the patients typically go home that evening with maybe a little tenderness, a little soreness, but none of the pain that they've experienced, even with a deep cleaning. This is a procedure that patients perceive as very appealing because of its non-invasive approach and its reduced pain outcome, as well as the regenerative effects.
Dr. Gregg told us it's rewarding to be able to help his patients.
I am a lucky guy. I get to see a lot of patients who are trained through our institute. We train a lot of doctors to help their patients, and that's immensely gratifying. But there's nothing that is replacing the feeling that I get when I can have direct touch with another human being and remove their disease and restore them to health and keep them stable. There's no other feeling like that in the world.